All right, good morning, everyone. For those of you that don't know me, my name is James Blake. I'm an advisor at Brand AMG, and we are grateful for all of you taking your time out of your busy lives to gain some knowledge and to get some important questions answered. We're also confident that we're going to provide some value to those that are still working and approaching age 65, to those that are looking to bridge a gap between retirement and Medicare, and then to those who'd like help navigating the complexities of the Affordable Care Act for maybe a child with special needs. And then to those that maybe you're just frustrated with the plethora of ads that start showing up around October of every year. These are just a few of the examples of maybe some of the questions that we'll try to address. But whatever your motivation for signing up, we want to emphasize that independence has always been a core value for Brand AMG. And it's something that we look for in our insurance providers that we trust. No fees and great advice is something that Steinlage Insurance has provided for our clients for many years. And Karl Steinlage is a third generation owner of his family business since 1950. He has a bachelor's and an MBA from St. Louis University. He's married and has 2 kids, and he's had his insurance license for more than 20 years. If you've been one of the clients over the years that we've introduced to Karl, you already know that he's very knowledgeable, quite responsive, and he's very caring. He really wants to save your family money every year. So please join me in welcoming our trusted expert in the senior healthcare market and Medicare, Karl Steinlage. Karl, do you want to take the reins?
Absolutely. Thanks, James. Hi, everybody. So appreciate you taking some time out to join us today, and I will do my best to make this as engaging and pleasant as possible. I know not everybody enjoys learning and digging into health insurance, so I will do my best to ease that pain. So our agency has grown quite a bit in the last few years, very much appreciative of all of the referrals and support and ongoing business engagement that Brand has provided. So I want to thank them. I was trying to remember how long I've known Todd, and I think it's been long enough where I can't remember off the top of my head. So that means it's getting up there. And as we have grown, so as our footprint, and we are licensed in the majority of states now. So if anyone is listening to this not in the greater St. Louis area, or you have family or friends who are out of St. Louis, we absolutely can help anybody in any state. It's very easy for us to obtain what's called a non-resident license in some of the states that we aren't licensed in. We have what's called just-in-time licensing, which means that if someone calls me from Nevada or Alaska and needs health insurance or assistance, we can go obtain our license in real time with them to help them. So a couple of services that our agency provides. Number one, we are compensated by insurance companies. Our commissions are built into the cost of these plans. So our advice and guidance really comes at no cost to you. The cost of these plans, whether it's a Medicare supplement, a prescription plan, et cetera, it's the exact same whether you go through a broker like myself or you do all the homework on your own. We don't charge you or Brand any fees, and we are independent, meaning that we have full access to all of the plans in whatever state or marketplace you're looking at. A couple of specific situations that we help people with, comparing group coverage to individual coverage, navigating the individual market, which is known as the Affordable Care Act, Obamacare. So if you're not quite eligible for Medicare yet, which starts at age 65, and need help, or maybe your spouse is less than 65 and you're moving into Medicare, that gap between retirement and Medicare is something that we advise clients on all the time. If you're already on Medicare, we provide free annual reviews. So as we'll talk about, once you're in Medicare, it's not a set it and forget it, but there's a little bit of maintenance that maybe needs to happen each year, which happens around this time frame. The Medicare annual enrollment period starts October 1st, with enrollment starting October 15th and ends through December 7th. If you are on Medicare or approaching Medicare, it is impossible not to know this because you get blasted, inundated, bothered with phone calls, Facebook ads, direct mail. So over the last few years, we have seen the activity level and the nuisance of the advertisements for this market explode, and I don't see any end in sight there. And then finally, as we'll talk about, Medicare has what's called IRMA, Income Related Medicare Adjusted Amount, which basically means that the more money you make, the more you have to pay for Medicare. And there are ways to reduce those fees, which we'll talk about as well. So I wanted to give a quick primer before we jump into the Medicare market. This slide is really a snapshot of the Affordable Care Act. So the way that Obamacare used to work is the government would ask you to anticipate your income in the year that you buy coverage. So if I give you an example of a 63-year-old husband and wife that need to buy health insurance to bridge that gap to Medicare, if they retired at the end of this year and looked at purchasing insurance next year in 2022, the government would ask them to anticipate their 2022 modified adjusted gross income. And there used to be what was called a cliff right at 400% of the poverty level. So right around $70,000 for a husband and wife. If you ever heard somebody say, oh, I make too much money to get Obamacare, or I don't qualify for subsidies, what they're telling you is that their income was above this threshold. Well, the government passed a law in March of 2021 called ARPA, A-R-P-A, stands for American Rescue Plan Act. And what that did is that increased the income limits significantly for the remainder of this year and all of next year. So this cliff has now been removed and has been pushed all the way up here. So a husband and wife can now make anywhere between $125,000 and $200,000 a year of income and still qualify for financial assistance. So this is significant for anybody who's looking at retiring, maybe retired earlier this year or last year and kept retiree coverage or COBRA. Conversations maybe I had with you back, a year ago today when this benchmark pushed you out of getting a subsidy, it might not be a bad idea to go look and see if you qualify for financial assistance. So a great example here, household of two at $125,000 of income, we still have the same issues with Obamacare, like high deductibles and limited networks, but now you can see that the premiums that a husband and wife or a household of two pay are significantly reduced. So we're comparing premiums in the $300 to $600 range versus a COBRA option at maybe $1,500 to $2,000 a month. So this ARPA law passed a patch or an extension of the tax credits, and it's good for the remainder of this year and all of next year. What we don't know is whether those tax credits will be pushed into 2023 and beyond. So stay tuned for that. Medicare, the core topic of this webinar, starts the first day of the month you turn 65. There's a window 3 months before where you can enroll into Medicare. And so what is Medicare? Well, Medicare is the federal government's health insurance system. So as you're working, you're paying into the Medicare program. And the thought is when you turn 65 or you've been disabled for 2 years, you become eligible to start drawing on those health insurance benefits. And so you have the ability to enroll into what's called Medicare Part A, which is free to you, and Part B, which is premium based. So one of the questions people often have is, what is my Medicare fee for next year? Because that changes every single year. So the Part B premium without any income adjustment this year in 2021 was $148.50. That amount is typically taken out of your Social Security check. If you're not drawing Social Security, then the government bills that on a quarterly basis. Next year, that premium is going up $10 to $158.50. That gets you your Medicare card, which looks like this. And what does it cover? So very simply put, Medicare has a deductible if you go in the hospital, and a deductible for your medical services. After these deductibles are met, then Medicare typically pays 80% of your healthcare costs. So if you just have original Medicare and nothing else, you're responsible for these deductibles and 20% of an unlimited amount. So that's a great foundation that we'll build off of, but it's really not enough to do the job properly. So that's where all of these private companies come into play to offer supplemental coverage to cover the 20%, prescription coverage, dental, vision, etc. So if anyone listening to this is not on Medicare, a common service that we provide is guidance on how to navigate the front part of this. Right? I'm turning 65. I'm getting inundated with these ads and phone calls. Like, how do they know I'm turning? Where's all this coming from? And the assumption is that you're turning 65. You must be on Medicare, and so you need to buy some sort of Medicare supplement or a prescription plan. And companies are just buying mailing lists of people turning, birthdays of 1956 this year and 1957 next year. There's really no way to avoid that onslaught. It just comes. To sign up for Medicare, there's really two main ways. If you are drawing any type of monthly Social Security benefit prior to age 65, your own benefit, a widow's benefit, a spouse's benefit, etc., you are automatically enrolled into Medicare. So this red, white, and blue card will be mailed to you, and a word of caution is it gets in the mailbox with all of the other ads that you're probably used to throwing away at this point. But that Medicare card, if you are turning 65 and drawing Social Security, should show up in your mailbox right around 4 months before you turn 65. As people work past age 65, the likelihood of you not drawing Social Security increases. And so if you are not drawing Social Security at all, then there is effort needed to sign up for Medicare. And I would encourage everybody listening to this to go ahead and create a consumer account at ssa.gov. You don't necessarily need to do anything, but that's the same website that you could go check your earnings records or whether or not you have enough quarters to qualify for Medicare if you're a teacher. But that website or that username and password is necessary to sign you up for Medicare. So once you sign up for Medicare, the government will charge you the standard fee, which again, this year, $148.50, but then next year is $158.50. And then they will look back at your income from 2 years prior. So this is where we introduce this means test for Medicare called IRMA, Income Related Medicare Adjusted Amount. And to give you an example, if you are married anywhere in the country and your income in 2020 was $300,000, then the government in 2022 will put you in the third bracket because you're between 276 and 330, and the government will charge you an additional fee, which is this column, so roughly $300 a month, on top of your base Medicare premium. That is for both parties. So if all of your income is on one spouse or investment income or a combination of rental and Social Security, it doesn't matter. If you are married, they look at your household income. If you're single, the bracket or the column over here is what we use. And this is your surcharge for IRMA. So something to be aware of as you move into Medicare for the first time is the government is going to use your income from 2 years prior to determine whether or not you have to pay more. That is an automatic look back. It's something I tell them or you tell them. And it is a rolling 2-year look back for the rest of your life or until things change. So if you fast forward into 2030 and now you are fully retired with RMDs and Social Security, the government will use your income from 2028 to assess what your premium is for 2030. So there's really no way that we can avoid IRMA forever. However, a common path to Medicare is that you worked right up to age 65, retired, sold a business, deferred compensation, runs out, something to where you can use a life event to appeal the government's decision to look back at your income from 2 years ago. So if we use that hypothetical and say that your income was was 300,000 in 2020, and now in 2022 it's going to be 175,000. And this is where I think Brandon and I can communicate and do a great job to be aware of where these benchmarks are and where these opportunities are. But you have a really good chance of arguing that your income is going to be below the threshold rather than the third bracket. And so we have a pretty good basis to remove that $300 a month fee per person right away. And so there's a formal process and a form that you fill out. We advise clients on how to do this. I can't do it for you, but I can give you the answers to the homework and let you write them down and turn them in. If this applies to your situation, feel free to ask questions or reach out. If you're already on Medicare and you have an IRMA assessment, then those additional fees are just tacked onto your base amount and taken out of your Social Security check. So what we just described and priced out is what's known as original Medicare or traditional Medicare. So again, that's the foundation. All of these advertisements that you're seeing on TV, in the mail, at the grocery store, all require you to be fully in Medicare. So anybody that's telling you they're on a Medicare Advantage plan or a supplemental plan, they have Medicare A and B. Their Part B premium may vary significantly based off of their income. But now your homework assignment is, what do I do to cover the 20% prescription coverage, dental and vision? And so in a nutshell, what all of these different options are fighting over that part of this. And all of those options fit into one of two paths. So my advice to you, if you're listening to this for the first time or you're already on Medicare, is to kind of give yourself a test to see if you can figure out which path you're on, or if you're thinking of making a change or making this decision for the first time. The big decision here is, which path do you go down? So that would be my advice to try to simplify this. So this path is your more expensive but more comprehensive coverage path. So a Medicare supplement plan from companies like United Healthcare through AARP, Blue Cross and Blue Shield, Transamerica, Mutual of Omaha, right? Tons of companies sell this, but Medicare supplements are always lettered plans. Plan F, G, and N are the most popular. And what these plans do is they charge you an additional premium. That premium varies significantly based off of where you live, which level of coverage you have, and how old you are. But a good spread is between about $80 to $250 a month. So if you buy a Plan G supplement, which is the most popular supplement, that supplement pays everything except for the very first Medicare deductible. So what people love about Medicare and a supplement is that they have the ability to go to any doctor in the country that takes Medicare, and after they pay their small deductible, they are 100% paid for. When they go to a doctor, they present that red, white, and blue Medicare card and whatever version of the supplement they buy. So what you're doing is you're paying additional premiums on top of your Medicare fee, and that's how you cover the 20%. You're also bundling that with what's called a standalone prescription drug plan. So this drug plan has nothing to do with the supplement. They may be the same carrier, but these are two independent moving parts. Your supplement can be purchased the first time you sign up for Medicare without answering any health questions. So if you're new to Medicare, a big reason why you may buy a supplement is you like the idea of buying the more comprehensive coverage right away. And this may be the only time that you can get on a supplement because of health history. So if you have pre-existing conditions and you don't buy the supplement the first time, the company who you choose later on in life may not accept you. They have the right to underwrite, which means use your health history, your height and weight, prescription usage to decline you, or rate you up and charge you $500 a month. A drug plan does not have underwriting, so you can change your drug plan without answering any health questions. So this path is your high option. You supplement Medicare by buying an extra policy, and then you buy a drug plan, and then you decide whether or not dental and vision is worth it on the backside. What people love about this setup is they go anywhere they want. So if you have multiple residences, you put a premium on access to care, going anywhere you want. Those are all buzzwords for buying a supplement. The downside to that path is that the premiums increase over time. If you're healthy, you may feel like this is a little bit of an overkill where you're paying extra premiums and maybe you don't even meet your deductible because you go to the doctor once or twice. But I would also argue that, your health could change very quickly. Maybe what a great problem to have is you're not breaking even on your supplement. But that is consistent feedback we get from clients who are healthy on supplements, especially as the rate goes up. They feel a little frustrated, rightly so, that, hey, I didn't use it, but my premiums went up. So if you don't buy a Medicare supplement in a drug plan, then the other option to solve for that 20% in prescription coverage is Medicare Advantage. And this market has grown quite a bit in the last 5 or 6 years. What happens on a Medicare Advantage plan is instead of buying an extra policy that pays the 20%, and pays second to Medicare, you agree to let the government subsidize a private insurance company, United, Aetna, Humana, and that insurance company takes this funding from Medicare and replaces Medicare. So a good way to understand Medicare Advantage, just conceptually, is that the government to pay 80% of your claims in Colorado, Missouri, Florida, right? The cost of care is different in different parts of the country, just like real estate. So the government knows on average how much they will pay to cover 80% by geographic location, right? They have thousands of people are on Medicare, et cetera. So if you're on an Advantage plan, the government pays that fee, and that fee is going to vary between about $8,000 to $15,000 based off of where you live to this private insurance company. So you still pay your Medicare fee to the government. And if you have an income adjustment, that still goes to the government. But now the government is paying United Healthcare that 10 or 15 grand that they would have spent and more or less pushing you into United Healthcare's version of Medicare. So a phrase I use a lot is the government's trying to control costs, right? It costs $10,000 a year to provide 80% of your care. Here, United Healthcare, we're going to pay you the 10 grand. You guys go make it work. So United Healthcare gets this funding from the government, and that's where they receive the majority of their premium from. So on a Medicare Advantage plan, what happens? Medicare is no longer your primary payer. You still have Medicare, but you put that red, white, and blue Medicare card away and you show your private insurance company HMO or PPO card. So in exchange for hopefully a lower premium, right, because you're not paying the extra $180 for Plan G and your $15 or $30 for a drug plan, you're probably on an HMO or a PPO that's charging you a very small premium and oftentimes no premium. The trade-off is that now you agree for 1 year to get all of your care through that private company. And that private company sits at the table with you and your doctor and has some input on coverage decisions. So a negative of Medicare Advantage is that you give up all of the freedom to choose any doctor in the country that takes Medicare. And that's replaced with a network of providers specific to where you live. So you're giving up some freedom in a Medicare Advantage plan. The other thing that you do is the Medicare Advantage plan doesn't pay the 20% in full like a Medicare supplement does. So on most Medicare Advantage plans across the country, you pay defined copays, which are pretty reasonable, up to the maximum out of pocket, which will range widely based off of where you live. So an Advantage plan is a lower premium, but the trade-off is that now if you get sick, you are limiting where you can go. You may need referrals or pre-authorizations for coverage, which sometimes can hinder getting what you want or limit how much therapy you can have. In exchange for that concession, you're hoping that your premium, which or the premium that you're saving on a supplement, and the out-of-pocket costs on an Advantage plan are less than what traditional Medicare and a supplement is. So if I give you an example, if you have your knee replaced, over here, if you're on Plan G, it costs you $217 next year. You can likely go to any orthopedic doctor in the country that takes Medicare, which is 99% of them, and you have access to the most physical therapy that you can get. Not forever, because Medicare is not going to let you go for 3 years and turn it into personal training, but it's very liberal. On an Advantage plan, that same claim would more than likely be covered, but you would have to jump through whatever pre-authorization hoops exist. A lot of times that's tasked with the doctors doing that, so it's not really the patient's job usually, but sometimes if the company doesn't authorize what you want to have happen, there can be some friction. But if it is covered, then you have copays for the hospital, copays for the MRIs and the outpatient care, and a knee replacement may cost you anywhere between $800 and $4,000 on an Advantage plan, depending on where you're at. The total cost may be 25 grand, but remember, the Advantage company is paying the 80% that Medicare would have paid. On Medicare and a supplement, Medicare pays 80% of the knee replacement. The supplement pays the 20% in full. So hopefully that helps distinguish between these two paths. So if you're on a Medicare supplement plan, another thing that we look at for clients is the rate you're paying for Aetna or United Healthcare or whoever it may be in relation to what other companies may offer. So if you have a Medicare supplement and you've been on it for a few years and those rates have gone up, you can stay on the same path and maybe switch from one Plan G to another Plan G without giving up any benefits. Typically, to switch, you have to answer health questions. But in a handful of states, we have what are called guarantee issue provisions. So Missouri, believe it or not, is actually one of the most consumer-friendly, liberal, with its application of these insurance laws, state compared to the other 49. So in Missouri, we have this great rule called the anniversary rule. And that means if you bought your Medicare supplement plan, F or G or whoever it is, on June 1st of 2015, every year in June, you have a window to switch apples to apples coverage. We're not changing paths. We're not changing drug coverage. But on that anniversary, you can change without answering any health questions. So that's a unique opportunity if you live in Missouri. And then a handful of other states have birthday rules or some other variation of that. Illinois and Nevada came to the table and have introduced birthday rules. So it's the same idea. You can change your Medicare supplement plan during some window, but that window is your birthday month. So if you live in Illinois and you have a Medicare supplement and those premiums have gone up and you'd like to not reinvent the wheel and come over here, but maybe save some money and keep the same coverage, I have an opportunity to maybe help you without having you answer any health questions. And then there's a few other states that have adopted something like this as well. Outside of this window or these states, you would have to answer health questions to switch from one Medicare supplement to another. So during this end of year window, the annual enrollment period, typically what we see is that people, if you're on a Medicare supplement plan, we're reviewing your drug coverage. So we're not changing this all the time because usually that is specific to health questions or your anniversary period, maybe in April or July, whatever. Your drug plan is specific to the end of the year window. So during this end of the year window, you can change paths left or right. So if you're on the high side and you want to go to the low side, I can do that, no questions asked. And that's because a Medicare Advantage plan is compensated based off of the average cost of care in your area. So Medicare is paying the private company based off of healthy, not healthy, everybody in between. So a Medicare Advantage company has to accept you. It's the same product whether you're 65 in great health or 80 in poor health. But to go the other way, and this is the big kicker, if you're on a Medicare Advantage plan or you drop a supplement to come over here thinking that the grass is greener, and then you learn the hard way, wow, I have a lot of copays and a doctor I didn't think about when I made this change isn't in my plan, and I get sick and I need to go see them later in life, and you want to come back over here, now you have to answer health questions. And that supplement that you were on and dropped doesn't have to take you. So that's a caution, is that if you're thinking about moving to Medicare Advantage, it's not right, wrong, it may make a lot of sense in your situation, but we just need to make sure that you're fully educated on the pros and cons to make that decision. Like I said, during this end of the year window, AEP, annual enrollment period, you have the opportunity to change your drug plan or change your Medicare Advantage plan without health questions. Your Medicare supplement has nothing to do with the annual enrollment period whatsoever. So if you currently have a Medicare Advantage plan, and also Medicare Advantage is sometimes known as Part C, then you have the chance to switch from HMO to PPO, PPO to HMO, from Aetna to United Healthcare, or back and forth. So since there's a lot of government funding in this market right now, we have seen plans add additional benefits, freebies to try to entice you to drop your supplement or maybe change from one plan to another. So some of these Advantage plans have some dental, some vision, hearing aid coverage. Everybody's probably seen the Joe Namath commercial running for 4 years now, nonstop on TV, talking about getting some of your Medicare premium paid. And it's important to note that to get that benefit, which they don't tell you about on TV, your income has to be under about $20,000 a year for a household of two, or about $12,000 a year for a single person. So if your income is over that and you call that line to inquire, what you don't realize is that they just sell your data to all these other insurance companies, and now you're in their marketing systems and you don't qualify for the benefit that enticed you to call. But some of these other benefits are just embedded into the Medicare Advantage plan. I always tell clients, I wouldn't drop a supplement to go to an Advantage plan specifically because there's some dental or vision, because a lot of times those benefits sound great in theory, but when you go to use them, you quickly find that they lack a lot of substance. So don't make those extra benefits the reason to change. But if you're on a Medicare Advantage plan now, or maybe mom and dad are, you're learning about this for friends, whatever, Medicare Advantage is absolutely an appropriate product. And these extra benefits may jockey one company out in front when we're comparing multiple plans that don't charge premiums. We also have a number of plans next year that no longer require referrals. So if you're on an HMO plan that has a referral and that's been bothering you, maybe that's a solution that we have access to next year. If you have a Medicare supplement plan and a drug plan, your supplement doesn't change. That's one of the nice things about it, is that the benefits never change. The rate can change, and it will, but your benefits never change. So you really don't have a lot of surprises when it comes to going to use it, right? My Medicare Plan F or Plan G always pays 100%. As these deductibles ebb and flow, right? Everyone always hears the changes in Medicare. And yes, there are some changes, but that's also just a phrase used to try to drum up engagement and get you to click on a link to fill out your information or to call a number. And realistically, all that entity is doing is using that phrase, changes in Medicare, to sell your data to third parties. But on a supplemental plan, as these changes occur, it always gobbles up 100% of what's left behind. On a Medicare Advantage plan, it's a little more dynamic. A doctor could leave a network, right? You do all this homework at 65, vetting your doctors, and if you don't need that orthopedic doctor for 3 more years, there's a chance that that doctor may leave the network of the plan you're in. right? Those are risks that you're conceding to in exchange for hopefully a lower premium. So if you have Medicare and a supplement, the biggest thing we're looking at now is reviewing your drug coverage, because the drug coverage can change on you positively or negatively on either side. You can have pharmacies drop preferred status, you can have plans drop prescriptions. And so it's prudent just to review your drug coverage each year to make sure you're not missing anything, or maybe you're taking new medications that we didn't know of last year. And so what we help clients with is just reviewing their drug coverage each year to make sure they're in the most appropriate spot. If they are, or you think, wow, this is just way too detailed, I'm in the middle of travel, vacations, weddings for kids, my health isn't great, I don't want this stress of reviewing this and changing. Note that every plan on both sides of this automatically renew every year. And so if you do nothing, you stay on the same plan. We find that anywhere between 70 to 90% of people end up staying on the exact same plan. So don't think you're missing out by switching every year. And in fact, I think you'd find that after 3 or 4 or 5 years of doing that, chasing premium or chasing, a lower copay at the doctor, it gets exhausting because you have to relearn a plan, but you also forget the reasons you changed. And sometimes you end up, stubbing your toe along the way, and you forget to change pharmacies or whatever, you needed to do to save a couple bucks on the front side. You may forget to do that as life goes on. So we get thousands of review forms back from clients, and we try to give ourselves more time than just October 15th through December 7th. So if you're a client of ours right now, we likely reached out to you in early September asking you for updated information. And we're not ignoring you, but we really can't do anything until October 15th. So a lot of times this market is this hurry up, review it, but then wait until October 15th when all of the quoting software updates and all of these plans turn in their products for the next year. So we just ask for a little bit of grace, a little bit of breathing room as we work through these reviews, and maybe give us until the first part of November to reach out if you haven't heard from us. But as long as an application is in by December 7th, it will start the first of the year. So this is something I've talked about in years past, right? How do we minimize the frustration of Part D? Because that's really where most of the headache lies on Medicare. Your drug costs change. You have this thing called the donut hole. So these are some common ways to minimize the frustration. GoodRx is a great tool to use for drugs that are not on your formulary. So common medications we see, like hormone replacement drugs, creams and lotions for dry skin, eczema, etc. Those sometimes are better purchased through GoodRx or through Costco. There's also a pharmacy in St. Peter's. It's called St. Peter's Community Pharmacy that we've referred a number of people to. It's a compounding pharmacy. So if you're on any kind of unique compounded medications, St. Peter's Pharmacy, shoot me a message. I can get you the contact info, but that's a great local source to utilize. And then if you are on no medications or nothing's changed, we still encourage you to send that review form, because maybe there's a new plan that came out for next year that has a lower premium and better benefits. So if you send us that review form, that's our way of reviewing the plan you're on and maybe switching you to save premium dollars even though nothing has changed. So here's what that review form looks like. If you need it, shoot me a message. James can help out there. And if you reach out to Brand as well, we can get that over to you. But this is the form that we utilize to try to capture the relevant information to review your drug coverage. And then we push that through this tool called the Medicare Plan Finder. So this tool lets us review all available drug plans and Medicare Advantage plans anywhere in the country, and we can tailor that to your specific situation, your specific drugs, your specific pharmacy, feedback you're giving us on certain medications, etc. So it really helps us give a very tailored, specific recommendation for the upcoming year. Every year we get review forms that clients send us, and it just says, hey, I'm happy with what I have. I'm not going to send you my info. I know you're busy. I don't want to bug you. And I appreciate that gesture. And yes, we do get very busy. I would argue that this window is more stressful and more time condensed than accountants in April. They may beg to differ, but our window is shorter and it's a little more flighty and variable year to year. But is a review necessary? I think so, because it seems like every year, one or two players in the Medicare drug market and Medicare Advantage market just decide that now's the time to get out of line. So this market, the pricing has turned into internet and cable strategies where we give you a good deal, right? If you're new to Medicare right now or in the near future, you're probably much more price sensitive than someone that's been on the same plan for 25 years using the same mail order vendor and hasn't made a change from 65 until 90. So these carriers know that, and they know that if they give you a good deal for 4 or 5 years, in that 5th or 6th year, that's our opportunity to maybe raise the price without improving benefits. So in 2020, we had a company go from a really great deal for a few years up to $50 or so a month. Next year, the opportunity is on 2 plans. If you have a drug plan called WellCare Select, anywhere in the country, if you look on your ID card and it says WellCare Select, that plan is going from about $23 a month up to, I think, $69. No improvement or nominal improvement in benefits, but really just tripling the premium because. So WellCare Select, if you have that plan, if you bought that plan through me, know that you're on our radar to reach out to in the very near future. And then Anthem, Blue Cross and Blue Shield Enhanced. So those 2 plans next year seem to be like the big ones that are kind of getting out of line and are ripe for a review. Another great opportunity is if you are diabetic. The government in 2021 passed a law that allowed certain plans, or plans if they decided they wanted to cover insulin before, during, and after the donut hole. So if you've never heard that term before, we'll talk about it in a second. If you're on insulin or other expensive drugs like Xarelto, Eliquis, biological medications, breathing medications, you know all about the donut hole. And what the government did and extended into next year is they allowed certain drug plans. So we'll go back to this slide here. If you have Medicare supplement in Part D or a Medicare Advantage plan, depending on where you live, there are about 30 different versions of Part D that you can buy. WellCare sells Wellness, Value Script, Select, right? They have different acronyms, but the same insurance company, different, flavors of the plan. Same thing with Medicare Advantage, which includes your drug coverage. So the government allowed different flavors of Part D and Medicare Advantage to opt into this insulin saver program. So what we found is about 1/3 of the companies offered a version of upgraded drug coverage. So if you're not on insulin, this probably has no significance to you. But if you're diabetic and the doctors talk to you about putting you on insulin, or you're already on insulin and you haven't reviewed your drug plan in the last couple of years, and you are not on one of the 9 of 29 or 9 of 36 Advantage plans that have offered this upgraded coverage, you're missing a few $1,000s of savings. So here's a snapshot of 2021, exactly what I'm talking about. This drug plan was one of the 30 that did not offer upgraded insulin coverage. This one did. And you can see down here, the total all-in cost, which includes the premium times 12, whether there's a deductible, your copay on the insulin, your copay in the donut hole, is about $600 a year versus $3,600. So significant savings if that client changed from this plan to this plan to capture that upgraded coverage. So what we're talking about with the donut hole is unavoidable on every individual Medicare plan. So anybody listening to this, if you have a retiree plan through a previous employer that offers you a Medicare plan, a lot, which is few and far between nowadays, but if you're thinking about reviewing your retiree plan to an individual product, oftentimes one of the things that retiree plans have is no donut hole. So I always encourage people, we find retiree plans are starting to get really expensive. They're almost non-existent today, but if you have one, the 2 or 3 things I would want to know if I were you is, if I leave, can I come back? And does my plan have a coverage gap or donut hole? Call your retiree administrator and ask them those 2 questions, because those are important pieces of this that a lot of times are not very obvious for somebody looking around. But any individual plan that you can buy has a gap in coverage. So let's make up an example. You pay copays for the first $44.30 in dollars spent. So how I would describe this is, each year in January, your drug coverage starts over at 0. Everybody's bucket fills back up to $4,400 approximately. When you go buy a prescription, and let's say your insulin is a $50 copay, you pay your $50, but the insurance company pays everything else. And a lot of these drugs, Eliquis, Xarelto, Ozempic, stuff you see advertised on TV, those drugs retail for anywhere from $500 to $1,000 a month. So if you're only paying $50 and the insurance company is paying $950, you've just taken $1,000 out of your $4,400 bucket of money. So how you run out of money for the donut hole, it's a common question we get, is it's not just what you paid, 0 for a generic, $35 for a brand name drug. It's what you paid plus what the insurance company paid. And that quoting software we use tells us what the negotiated price is, which varies widely based off of what plan you have and what pharmacy. So sometimes a review can help minimize the donut hole by putting you on a plan that covers your drugs for a little bit less. It may not exclude it all the way, but it might just lessen the pain here. But what counts towards the donut hole is the negotiated price of your medicine. So in that example, every month you go get your insulin filled, $1,000 approximately is subtracted from your $4,400. You pay that copay until costs exceed the $4,400 threshold, which would be about 4 months. And then on the 5th month, when you go to the pharmacy, you have to pay 25% of the negotiated price. So in May of next year, you walk in, instead of paying your $50 copay, the pharmacist says your insulin is $250. And you pay that $250 or 25% of the cost, right? So if the drug is $100, your copay is $25. Your generics that are free may go up to $1.10 or whatever it might be. You pay that until either the end of the year or what you've paid out of the $4,400 and what the insurance company pays exceeds approximately $7,000. If you leave the donut hole, then you move to the last stage, which is called your catastrophic stage, and your coverage kicks back in. So an example would be on that insulin client, you're in your initial level. We'll just ignore the deductible now for simplicity, but you pay your copays for 4 months. So you're in stage 1 for 4 months. You would be in this donut hole for about 4 months. And then on the 9th month in September, you would go back and the pharmacist would say your insulin is now $50. Why did it drop? Is because you exited the donut hole and you pay 5% of the cost. And you're there for the rest of the year. So a lot of clients, if you're not on some of these name brand drugs, you never spend the $4,400. You may only spend, $100 on your copays, and the insurance company spends $500. Well, you have $3,600 or so left behind that just dissolves, and we start back over January 1. A lot of people may have this donut hole, they just don't realize it because it's out of sight, out of mind. But if you're on these blockbuster medications, then you're very aware of this gap. And if you're on one of these plans that covers insulin through the donut hole, what happens is you pay $25 a month for your insulin the entire year. So when you fall into this hole, your coverage remains the same. So that's why is this cost so much higher? Is because you're paying $250 a month for 4 or 5 months instead of 25, and that adds up to a few $1,000s over the course of a year. So every year in usually May to September is when these calls start happening. You know, I got sick now, I got put on Xarelto. I didn't spend my $4,400 because I only bought 1 or 2 refills of that drug, right? Because I got sick in October. Well, now we start back over in January and you've got 12 refills this next year and you run out of money in April or September, whenever it is. Buying a more expensive drug plan doesn't get you better coverage here. All it does is add additional cost on top of the donut hole. So hopefully that helps. I know this is a very confusing subject. Why we have a donut hole in the Medicare plan is beyond me, but this is the way that Medicare's drug coverage has worked since it was developed in 2006. You may have heard about passing a legislation for closing the donut hole, or I thought it was going away. And if we nitpick that statement, technically the donut hole did not go away. What it did is it was reduced. 5 or 7 years ago, this hole was a lot bigger. And so you only had maybe $3,000 to spend. So your initial bucket of money has grown. And then when you fall into this gap, you used to have to spend 100% of the cost of the medicine. And so over time, that's gone from 100 to 70 to 60 to 50 down to the floor, which is 25%. And as of today, there is no, that's the end. The government has not passed any legislation at moment to close it entirely or to put an annual maximum out of pocket on prescription coverage. So other questions we get asked about all the time, dental, vision, and hearing aids. And the short answer on this is there's really no great options here. Dental is very expensive, whether you have insurance or not. But I have yet to come across a product that I would wholeheartedly endorse like every single time. I know we had a plan a few years ago that didn't have a waiting period on major services. Well, I think we went to the watering well too much on that, and the company quickly realized that they were not making money with people buying their coverage for a month or two and then going and getting $1,500 worth of root canals covered right away. So that fell off. But most plans run anywhere between about $30 to $60 a month. And when you really kind of digest it and you look at what you're paying compared to what you're getting, very rarely do those premiums benefit you. So my advice typically is if you're losing group coverage, check extending Cobra Dental only for the 18 months, because a lot of times group dental is cheaper than what I can get you independently, and it's better coverage. So you may run with that for 18 months. Most of these dental plans, if you're replacing coverage, so if you run out of Cobra and you want to buy a plan, or you're retiring and you want to buy a plan, I can get you one without a waiting period because you've had consistent coverage. So that may change your recommendation if you know you have some other stuff going on. But a lot of times after that 18th month, you just decide it's not worth buying. We recommend a lot of people go to Costco and Sam's Club for hearing aids and glasses. So you would they have a full optometry department, full hearing aid department. You can actually purchase prescription glasses directly from Costco for cheaper than what you can go locally to an independent optometrist with vision insurance. If you have access to VA benefits, veterans benefits, a lot of times you can tap into these extra benefits there. You still would more than likely maintain your medical coverage through Medicare, but the VA can be useful for that. Prescriptions as well. If you have access to VA benefits and you maybe aren't utilizing them fully, that might be something to reach out and we can give you specific advice. And finally, we've seen a lot of dentists offer in-house programs. They know that a lot of seniors have dental issues. There's not great options out here. So a lot of dentists have more or less a prepaying of your cleanings in exchange for discounts on something significant should it happen later on. So wrapping up, what to take away, an annual review can just save you a lot of money sometimes, reduce a lot of frustration, just make sure you're in the right spot for the upcoming year. If you're new to Medicare, picking your path is the main decision that you make. Do you want to go the high side, buy a supplement and a drug plan, or do you want to go the low side, buy Medicare Advantage? My advice, if I were in your situation, I can afford a supplement. I feel like that's money well spent, even if I'm not using it, because if you get sick, if you really start using this type of coverage or using your health coverage, there is no better spot to be than original Medicare with a Medicare supplement. And so that's my 2 cents. Is I'm a big fan of, if you can afford a supplement, why not buy the better coverage? Because there's a good chance you're going to use this later on. And if you wait too late to try to switch, then you may find yourself locked out from that market. But picking your path is the main decision on Medicare. Once you make that decision, you get to throw away half of the stuff, you clear off half of your dining room table, and then we focus on which Medicare supplement company and lettered policy gives you the best bang for your buck. Any questions? I'm happy to stick around and answer for a little bit. My contact info here, James, if you have anything you want to add or any questions, I am happy to hang around and answer them.
Carl, you did a great job. There's no questions in the actual dialogue piece. If anyone wants to add them, it's still on. Feel free, and we'll try to answer those as best we can. If anyone has a follow-up question that they just want to email myself or Karl, you can email me, and I'll definitely forward it on to Karl. And any other questions, we're available at any point. Did one came through? Did you see that, Karl?
Yeah, I did. Yeah.
Okay.
So question was, if you're employed, do you recommend using Medicare as primary or secondary? That's probably worth a quick 10 or 15 minute chat with me, because there's so many moving parts. But if you are on a large employer, more than 20 full-time employees, and you're going to continue to work full-time past Medicare, you probably don't want to sign up for Part B. So Medicare and group coverage is kind of like oil and water. They just don't mix well. Even if you force them to mix up, they're going to separate and frustrate you, because Medicare is going to, if you're on a big employer, over 20 employees, then Medicare is secondary. And providers are almost always taught and ingrained, if I see a Medicare card with A and B, that's primary. And so you get into this, you mean well, because maybe you want to buy more coverage because you have a big deductible on your employer plan, but it ends up probably doing more harm than good. And there's all these nuances on, well, if you're on a small company with less than 20, then the rules are different. Medicare becomes primary. So there it's like, yes, you actually have to sign up for Medicare. And then you've got anywhere in between where maybe, if you own the business, you may find that moving to Medicare is a better deal financially, right? Since you own the company, you're probably paying the health insurance premiums versus being on a Boeing type plan where you pay very little as the employee and your employer is subsidizing all of the cost. So that's tricky to answer, but ends up being an easier conversation just if I can kind of pull the pertinent information out. And then follow-up question is, if you don't sign up for Part B, yeah, you delay the decision of supplements versus advantage plans. So it sounds like maybe you are going to work past age 65, and what you're doing there is you're saying, hey, I don't need this now, especially if your income is high. Medicare is probably a really bad deal for you. Or if you have a spouse or kids who are on your group insurance, then you may look at this with like, wow, Medicare is okay for me, but if I cancel my group insurance, what do I do for my spouse and kids? I've got to go buy them Obamacare or Cobra. Like, that makes no sense. So what you would do there is you would delay taking Part B until you were 70 or 68 or whatever life event work stoppage, retirement causes you to no longer have group coverage. And then what we would do is we would help you sign up for Part B without a penalty at 68. So we would show Medicare, hey, you've had other coverage. That's why you didn't come to the table here at 65. And then we would get you to the table appropriately so you can get it right when you need it and there's no penalties. And yes, then you're delaying this decision tree until that time. So at 68, you still have the opportunity to buy a Medicare supplement plan without answering any health questions because you delayed your Part B appropriately. So that's why that situation is important to get right on the front side. With a quick phone call, we can make sure we're giving you the correct advice. Never easy.
Well, I think that may be all the questions, but anyone there that's still listening that has a future question that comes up, please reach out to me. I'm happy to forward those on to Karl. Like I said in our introduction, he's extremely responsive, so he's willing to answer any questions that you may have because it is a complex space. So we're glad that we have Karl to work with.
It was good seeing you guys. All right, take care, everybody.
See ya.